Hi, Dr. Shin here. Today I'm going to be talking about flossing. So, there are two types of floss that are out there. We've got the regular string floss, and there's several varieties of this. There's tape, waxed, unwaxed, but basically it's the stuff on a spool that you pull out. The other type is a flosser, that is basically a piece of floss that is already connected to a U-shaped plastic device like so, and it's like a little bow that has a little piece of floss here. Personally, I recommend most patients to use the flosser only because it just makes flossing that much easier, and patients tend to floss more regularly using it. However, the regular floss is also excellent, so whatever works best for you is what you should use. Today I'm going to be demonstrating flossing techniques and basically the best way of how to most effectively use the floss to clean in between the teeth. So, when you look at this model here, I use this flosser, and what we're going to do is get through the contact, and as soon as we get through that contact, you see the floss is between the teeth near the gum line. And what a lot of people tend to do is they will saw and kind of pull the floss back and forth, or if they're using the string floss, they'll kind of do one of these. You don't want to use that action because that doesn't really do anything to clean between the teeth. What you want to do is you want to get the floss in between, and you want to use a vertical motion. In addition to going vertically, you want to pull the floss so that there's a little bit of tension against the tooth, and you just go straight up and down, and you'll see how the floss is cleaning that in-between side of the tooth. And that area is an area that even the toothbrush can't clean, and the floss is going to be the only thing that's going to be able to get in there, which is what makes flossing very important. So once the floss is between the teeth, you're going to clean one side of the tooth next to the floss, and then you'll push the floss to the other side of the tooth adjacent to the one that we just cleaned, and we'll go straight up and down again. In addition to cleaning the sides of the teeth, you'll notice that when you keep tension on the floss and you're going up and down, you actually get between the tooth and the gum. And you push all the way down, you'll meet resistance, and you know you've gone far enough. And you want to make sure that you do get between the tooth and the gum, because that is where a lot of the bacteria, the plaque, like to hide out. Once you get into those areas, you go ahead and remove the floss, and you go into the teeth next to those guys, and so on and so forth, until you get through the whole mouth. So that is flossing in a nutshell. Next time, shoot. Dang it. No.